This is a part, as I said, of the same project of preview, but of course this is a more recent introduction in clinical blood-based biomarkers, but we are trying to apply this method in the same population, so actually both in cerebrospinal cognitive decline and also considering patients with mild cognitive impairment, but what we have done is to not divide patients based on just on their cognitive performances, but on their pathological substrate. So we classified patients, both subjective cognitive decline and mild cognitive impairment patients were classified based on the presence or absence of an Alzheimer pathology based on CSF biomarkers. And we tested for NfL, also p-tau 181 and GFAP. And we have seen that these blood biomarkers are extremely precise in detect patients who had an underlying Alzheimer's disease pathology. So with the inaccuracies that reach also 95%, with different accuracies considering, and what we are trying to do is also to understand how to use and when to use each biomarker. So also trying to understand what is the issue when some biomarkers is not, when the results of the biomarkers are not consistent among each other. So to understand which biomarker is more relevant at the beginning of the pathology, and which biomarkers is indicative of a progression. And for instance, based on our results, we are mainly focused on neurofilament light chains, because these biomarkers show that is really it's an early biomarkers that change in early phases, also in patients with subjective cognitive decline, and that change during the pathology. So we can perform this assessment many times after, for instance, we can assess at baseline, but also after months or after years, and the changes of this of the concentration of blood neurofilament light change can be indicative of the trajectory of the patients to neurodegenerative condition or to a non-neurodegenerative condition. And of course, this is fundamental because thinking about the need of something that can be applied in a primary clinic, so to also considering that with the approval of disease-modifying therapy, we will have neurologists and clinicians will have an increase of requests of assessment of memory disorders, and having such accurate and easily accessible biomarkers is fundamental, both for baseline assessment, both for monitoring, also during thinking about also during administration of the drug, to monitor the how the drug is, if the drug is also effective. And we don't have data about this, but we know from literature that this could be also an application of these biomarkers.